Hi, Kim.
Hello?
Hi, Kim. How are you?
Wait a minute. I can't hear you.
Oh, wait. How about now? Can you hear me now?
Um,
Apparently not.
should I leave and come back in?
Well, let me see. Hold on. Hold on 1 second. Huh. I can hear you. Let's see. You can't hear me apparently, right? I don't know if
Okay.
is that. Hey, Mark. Hey, Mark, can you hear me?
I can hear you, Carrie.
Okay, good. Perfect.
So Terry, when it's time, should I just share my screen or?
Yeah, I will. I'll start. And then, so what I want to do is and we'll see who is in this session. As soon as we get more people in here, I will share my screen so you can see what it is that I'm doing. Can you guys see my screen?
Yep.
Excellent. Hi, Emily.
Hello.
Hi, I've added your note in here. And one of the things that you, as this conversation goes on and as the day goes on, one of the things that you can do is you can go into your profile and you can add methodologies or subject area. And then you'll find that you're connected not only to the different people, but the different presentations and the different ideas. And I've noticed that you've already entered a couple sparks, which is great.
Yeah, thank you for the tips. I didn't know how to use that, so great.
Yeah, no problem. That's one of the barriers that we want to get over in these conversations is let people know how to enter information. So you can enter sparks. You could enter a project or a challenge, and given the way that the conversations have been going, I've already started to make connections from the last talk that I was in to this talk already. And so there's one of the things that you can start to see is the different sparks that have been added. So, right, so there's this is actually really great. There seems to be a lot of overlap between Viz Responsibly and Kim Gallen's talk, which is interesting because the spark that I entered in the last session was brought up from the last meeting that had to do with dissemination of information in Indigenous populations, which reminded me, Kim, of what you may be speaking about. So
Yes, definitely.
yeah. So so notice this is the people who signed up for the session. Not everybody is here, and we'll just include people as they come in. But one of the, and I'll just keep letting people in as they come in, and Mark, you can let people in too as well. Is that we can keep referring back to this network diagram, and if you have an idea based on something that Kim says, you can go back to the home page and enter a spark this way, or you can from anywhere in the cognitive city. This is all the different views that we've got today. You can add a spark from up here in the top right hand corner from the plus. And like Dave showed this morning, it doesn't have to be a good idea. It just has to be an idea. And this is one of the ways that we're capturing different ideas, because something that you put into the city may actually spark something for somebody else. So again, Kim, thank you so much for the work that you've done already to prepare for this, and for being willing to participate with us in this conversation, in this experiment. So what I want to do now is give you a couple minutes or a few minutes to talk a little bit about the presentation that you already uploaded, but give us kind of the summary of it so that we can start the conversation from who's in this room now.
Sure. Would you like me to share my screen, or should I just talk? How would you like to do that?
If you've got something that you want to share, absolutely share your
Yeah,
screen.
I'll go ahead and do that. I'll be sharing my the presentation that I've already uploaded, but I want to give me one second. I want to, and let me know when you can see it.
Yep.
Okay, good. I want to just talk through a couple of things, but specifically show you one visualization that I'm working on, and love that to be part or drive a lot of the discussion, hopefully today, because it really does get into ethics and the impact of COVID-19 on the Black community. So I'll just run through a couple of slides and then really talk a little bit more deeply about some more specific things. So COVID Black is this task force on Black health and data. It really comes out of the pandemic, but really will exceed the pandemic, but really works at the intersections of race, data, and social justice, specifically Black health data. Really early on, as you all know, the pandemic and the racial disparities of people of color, specifically Black people, Indigenous people, has highlighted the Black health disparities, I should say the Black health disparities, the racial disparities that are largely byproducts of systemic racism, and that had existed obviously before the pandemic, but they've shown themselves to be really stark reminders of how specific communities are disproportionately impacted by the pandemic, as well as other health-related issues. COVID Black really tries to think about data in really different ways, thinking about this notion of living data and how to take data from really its quantitative state, right? And that's really been the big living data, the big data rather, that we've all sort of come to know through these data dashboards, and then the regular sort of updating of the nation as well as the world of the impact of the pandemic, right? Particularly in mortality data. COVID Black works more with this concept of living data and wants to get at the lived experiences of people, specifically Black people that have been impacted by COVID-19. And what that looks like is something called COVID Black Stories. This is a very early visualization of the mortality of Black Americans across the United States. Right now, it's only about 400 people. What my team and I have been doing since approximately April is combing the obituaries, death announcements. Thank goodness for journalism, which has many big major journalistic outlets have a memorial section where they are highlighting the notable people who have passed away from COVID-19 or some sort of human interest story. Well, we are mining those obituaries and death announcements and pulling out data and life stories, quite frankly, of people who have passed away due to COVID-19. And one way that we're visualizing that is spatially. Here on a map, obviously, we're up over 200,000 people that have died. So this is just a drop in the bucket of information about those people, but it is a place for us to start. Our goal is to crowdsource other stories at a certain point when this goes live. Again, it hasn't yet. Right now, it's still very much in the early stages. But if you can see here, we've mostly been able to collect data from the Eastern Seaboard. Obviously, New York has been a big place because it was the epicenter of the pandemic, at least in the United States. And we really, right now, have very little information about this sort of middle part of the United States. But if you click on the point on the map, you'll get the name of the person, the headline from which we have gotten the story from, and then a link that takes you directly to that publication to read about the specific person that died from COVID-19. And so again, our goal is to take these numbers, right, and transform them into life stories. And the second stage of this project really will materialize into a interactive visualization that will function as a digital memorial. Part of COVID Black's mission is to connect Black communities with their data and with their life stories. And so because so many Americans, including Black Americans, did not have an opportunity to have traditional funerals or traditional cultural expressions or services to mourn their loved ones, we are creating a digital space for people to memorialize people that have died from COVID-19. So that's what we mean by this notion of living data, right? Taking quantitative data that really strips away people's humanity and then recovering that information, that data, and bringing out the life stories of people. And we're looking forward to the interactive visualization that we will have very, very shortly. Just a couple other things to talk about. Because of the Black community's very tense and tenuous relationship with data, data has often, in the history of Black Americans, been used to pathologize or visualize the problem in terms of criminality, in terms of health disparities. Black communities historically have a very challenging, complicated relationship with this notion of data. And so one of the things that COVID Black is committed to doing is showing Black communities how they can be empowered and use their data to problem solve, make decision making, and then in many ways recover the notion of Black humanity. And so we do that by thinking very carefully about data ethics that shares power with Black communities around their data, right? Helping to teach data literacy skills, how to ethically collect data, how to ethically visualize data, and how to make decision makings. One thing about the COVID Black stories that is an ethically sort of complicated position to be in is while that information that we have culled from obituaries is public information, we still feel a responsibility to check in with families on whether they want their family members included in a data project of this magnitude. And while we certainly don't have the scale the team to reach out to each and every person, we will be creating some sort of mechanism for people to opt out of their data being used in this way. We might think that we're using the data in this very altruistic way, but that may not be shared by everyone. And the notion of reinscribing trauma onto particular communities that have been impacted by COVID-19 is at the forefront of how we're thinking of that particular project. Really quickly, one of the things that we did at COVID Black was really try to create an early response to getting data about race and ethnicity. It was this idea that in the humanities, we can be early responders in thinking about how to respond on the ground to crises like the pandemic. And just we can talk a little bit about the data and what the data says. And so you saw that in the presentation. Again, Black Americans and Indigenous people have been really impacted by COVID-19. And when we look at the history behind Black Americans and Spanish flu, we see that data, again, has been used to think really critically about how Black Americans were impacted. And while there's some debate on how much Black Americans were impacted by COVID, by the Spanish flu rather, the data still is very helpful in highlighting some of the places and areas where we see Black Americans being impacted, whether disproportionately or not, by the Spanish flu. And I can, talk a little bit more about that in the discussion. Tuberculosis is really the major public health crisis for Black Americans of the early 20th century. And we have historical data and graphs and visualizations that COVID Black is also going to be working with to talk about where public health was and learn from some of the quite frankly very strategic and very effective things that Black public health experts and other public health experts were doing in the early 20th century, and talk about what that can teach us about where we are in this particular moment. And I think it's really good to think about where we are, where we've been historically, and then to bring that forward. And then finally, thinking about public health information spread in Black communities. Not only does COVID Black work with data, but we also think about how health information is disseminated among Black communities, which again have a very complicated relationship with the medical establishment. And so one of the things that COVID Black does is to research that history and think about what that means contemporarily, and then try to help policymakers, public health experts, physicians create interventions that can help mitigate the spread of infectious diseases in Black communities, specifically in this moment, obviously COVID-19. And just to think about this particular moment and how social media played a role in that. Right now, in the realm of public health, as well in the sort of the political sphere, there are active campaigns and sometimes unintentional spreads of disinformation and misinformation about Black Americans' relationship or connection to COVID-19. And social media has filled in the gap that historically the Black press would have been in place to disrupt poor information to give quality information. Because of the decline of the Black press and autonomous Black media, that has been filled in with social media in some very productive ways, but also in some very unfortunate negative ways. And there are communication theories that talk about how people use social media both positively and negatively to disseminate information. And so finally, COVID Black is trying to disrupt this disinformation and misinformation with data literacy and discernment, good information and resources, and then countering and sharing quality information. So I'll stop there, and then maybe we can get engaged in a more interactive discussion.
So I encourage everyone to enter Sparks as you go along. There, there's a couple things, Kim, that you're talking about that sparked for me. Like one of the things that I noticed, I'm a big fan of contributing my data, and Of course, you know, I don't have a whole lot of experience of where my data was being used against me.
Yeah.
That's probably not true, you know, given the way Facebook follows me around and everything. But I know that with 23andMe, when I got that done, and you know, I know that I have Native American heritage, right? You know, I've got the genetics, but having some experience with genetics data, I actually was able to go into the references around 23andMe and realize that there is virtually no genetics data for North American indigenous populations because they don't trust, you know, why would they contribute that?
Yeah.
But so it's you know, I have a friend who said, you know, I want my dad to do this, but you know, there's been this story that we've got data in the background that is we've got blood, we've got Cherokee blood is it doesn't show that at all, and I'm like, well, the data is just not there, but they don't, but nobody talks about that, right? And so there's this whole conversation about data being used against
People,
against you. That's a huge thing, right?
Yeah.
I loved what you said about having an opt-out button, and it would, you know, I know with GDPR they were trying to do that, right? You know, let's let everybody opt out, but being able to, and on your visualization, being able to opt out of the data for whatever reason, you know, it gives people some agency back in being able to.
Right. I mean, ideally, it would be great if we could really contact everyone so that someone doesn't have to opt out, because you can imagine opting out is also problematic, right? I mean, you're still moving forward with information and data. Again, that is publicly available. I think one can argue that there's the ethical visualization and use of data, and then there's the legal use of data. Quite frankly, it's legal for me to use that data in that way because it is publicly available through news organizations. But does that make it ethically right? And particularly when you know the history of particular communities and the way they haven't been able to control their data, just because I may share a racial connection and affinity with the people that the data that I'm working with doesn't necessarily give me the right or the authority to use data without people's permission. So I'm very conscious of the fact that even though, again, I have a racial connection and affinity and ancestry, a heritage, I'm still in a position of power and privilege as it relates to my positionality relative to others.
Yep. Yeah, so that's one of the, I think one of the major problems that we deal with, data, you know. So does anybody have any questions given Kim's either recorded talk or what she's brought up in the conversation just now?
Hi, this is Emily Lynn. I have a question.
Sure.
So thank you very much, Professor Gallen, for the presentation. I was wondering to what extent you've thought about, so the geographic visualization of the stories.
Sure.
I think,
yeah.
You know, I always love anything with a geographic dimension to it.
Yeah.
And I was wondering if, I guess my question is around the concept of community and networks.
Yeah.
And so, you know, the exaptive technology is all about networks, and geography is one way of creating community, but what other ways are you thinking about creating social connections, or not necessarily even creating, but like visualizing and helping people use social connections as a source of power in this? Because like personally, I've seen a lot of mutual aid networks spring up, locally and around the country, but those are happening, you know, through Facebook, and Facebook doesn't let you see your network really. So those kinds of things. Yeah.
Thank you so much for that question, because it allows me to talk a little bit more deeper about this project. So obviously, as you say, you know, you have this spatial visualization, and that creates a certain understanding of community, right? And, as I'm going through the data, and it's so interesting about collecting this data, in my data set, it occurred to me, thinking about networks and relationships, is that unfortunately, COVID-19 is the type of infectious disease that impacts families, right? And so in my data set, I'm like, oh, I don't have a column to show how this person is connected to this person, like a relational column, right? So that as you
Yeah, exactly.
are, if you go through the map, it's difficult right now the way that it's presented to understand that there are numerous people in one family that have passed away from COVID-19 because they were in close contact and in some cases caring for another family member. So that's one way that that this visualization will evolve to show sort of in the familial networks or even in community networks how one person was connected to each other. And unfortunately, that connection resulted in contracting COVID-19 and then passing away. But the other way that we want to work with this data is to the ultimate visualization will be situated in a context in where there will be small videos of Black experts in grief and mourning, and there'll be videos, but the audience will be able to click on the video and actually engage in some sort of understanding of how this particular type of trauma for Black Americans creates a sort of set of connecting issues, right? So on the nightly media, we hear that whether you agree or not, that it is likely had the government had a different type of response, that there would be a certain number of people alive today, right? So part of the grief and the mourning may include anger, right? Anger that again, not trying to get political, but if you buy that theory that a different response, a more national response would have resulted in more people's being able to survive COVID-19, that grief is also maybe entangled with anger, as well as the idea that some of the people that passed away from COVID-19 certainly were essential workers, had comorbidities, that are byproducts of systemic racism that white communities are less impacted by, if impacted at all. And so that notion of making a connection and working with data to then have that data then sort of highlight the lived experience of grief that may be caught up with anger and trauma about what it means to be Black in the United States or a person of color in the United States, if we're talking about Indigenous people or Hispanic people, is part of the way that we want to connect Black communities to their data.
Thank you.
That's actually, that reminded me, somebody earlier in the conversation talked about sentiment analysis, right? Being able to add sentiment analysis. And that would be really awesome to add that to the
Nice.
Because when you first showed that visualization, I was like, God, how could you watch that without crying?
Yeah.
Right? Because I know for me, it's the idea of 200,000, more than 200,000 people dying is way too much for my brain to wrap around. And
Right.
looking at all the ways people are talking about being able to wrap your brain around that, like the different, I don't know if you saw the Doonesbury comic, like there's it's intense, but there's something about putting a human face to this that makes it, because we wouldn't be here if we didn't love data, right? But there's something about what's happening underneath the data that's really important to communicate.
Right. And it's been interesting to watch the ways that different entities have used data, right? So there's Faces of COVID on Twitter. There was a memorial in Detroit where there was a park where people have blown up the photographs of their loved ones, and it lined, a street in a park, which you could drive down and just actually see the faces. I think the New York Times had a visualization of people's names, as well as I think Time Magazine also had that. And so you see these efforts to take data, right? To take the quantitative data and breathe life into it, because I think ultimately at the end of the day, if data is not telling us a story, or we can't tell stories for data, with data, right, then what are we really doing, right? So data is obviously important in terms of the numbers and the sort of statistical analysis, but they need to lead to action item, decision making, things that can actually solve problems and mitigate the impact of COVID-19, if we're talking specifically about the pandemic. And one of the ways to do that is, as you say, Terry, putting a human face on it.
Mhm. Yeah. That's, science communication is one of my nodes, and, that it's important to be able to get the information across to people, but
Yeah.
people also remember things when they are emotionally connected to it.
Right.
So, it's so funny. We talk about scientists being objective, which we're not, right? We can't possibly be, right? And so there's an aspect of bringing I don't know, this is something that's been coming up for me a lot today, is just bringing the human aspect to it.
Yeah. I mean, I think that's why interdisciplinary teams are key. It was the first thing I did with COVID Black, is to reach out to public health experts, physicians, humanists, social scientists. I think in this particular moment, if you're not working across disciplines, or if you're not working in an interdisciplinary sort of environment, then you're doing it wrong. And I don't mean to be that strong, but I don't know how you solve the issues that have come up through this pandemic in silos, in disciplinary silos. They're not going to be effective solutions. You need everyone at the table working from their area of expertise, but also sharing their expertise in order to solve these problems. And I think that's one of the reasons why when you ask me to be a part of the Cognitive City, I immediately say yes, because the bigger sort of or the more we can sort of be in conversation with other people, I think the more effective we can be.
There, I'm muted. There, I'm unmuted now.
Okay.
There's So I'd love to hear from anyone who hasn't yet spoken about what's coming up for you inside of this conversation, or and what your particular background and your methodologies bring up for you while you're listening to this conversation, while you're thinking about this topic.
So this isn't really around like my particular area of expertise, but just kind of experience working with some climate change organizations. And like, as you describe like this project, and one of the things that really sticks out to me is like the power of that just like human story and connecting on a human level. And like one of the big things that I've been seeing like a lot in like climate mitigation is like translating that through artwork. And like when I saw your map, like I don't know, to me I was like this is art. Like I can look at this and like understand a human experience by like clicking on a node. So just again, from like kind of that cross-disciplinary perspective, it's like as you describe this, I keep just like hearing like this is artwork to me.
Yeah.
So it's like, what, I don't know, what ways can we continue to leverage that like kind of that human element to really reach that impact?
Austin, if I could just respond to that, I think that is like absolutely right. So 2 things to that. The map isn't done yet, but I've been working with the person who does GIS on my team. And I keep saying to this person, this has to be aesthetically engaging. So the first iteration of the map was a very stark looking map, right? And I'm like, okay, we need to work on this because as you talk about, I mean, basically, I think you're talking about design, right? And how even as we are visualizing what one might just say is just data, I think we have to think about the design element. I teach about the transatlantic slave trade as a historian, and there's this great visualization that I can pop in the link. You may have seen it. It's called the Transatlantic Slave Trade in 2 minutes. And it gives you a very powerful story of the transatlantic slave trade, but the design is horrible, right? And so we are we are sensory beings, and we are brought in by design and by aesthetic. And I think when we talk about data, and we talk about visualizing data, it has to also speak to a particular sort of sentiment or sensibility. And second point, the visualization that I'm working on now is I'm working on it with computer scientists, but I'm also working on it with a graphic designer, right? Because it is art. And I want people to have a particular feeling when they come to this memorial. It'll be multi-media, there'll be music that's a part of it. So, you know, again, what we do with data and how we visualize that is incredibly important. I don't think you can do that outside of a very sort of humanistic perspective. So thank you for that comment.
Thank you for this work. It's very touching. So keep it up.
Thanks.
For sure.
I love the idea of science as art because, you know, it just is, right? And maybe some artists wouldn't think so, but I think a lot of scientists don't think of it that way as well, but it really is. You know, it's you know, you mentioned a visualization around the slave trade, and I saw a comparison between the information, right? Like in specifically transatlantic lines, the optical, what am I thinking? What's the word? Fiber optics. Right, they actually follow a very similar.
Yeah,
it follows very like those connections are very similar,
yeah.
and people have made connections to how that's part of the conversation for data being used against populations. So.
Yeah, definitely. And I think what I like to think about the data that I'm collecting, it's sort of like counter data, right? And when I say counter data, it's data that has been sort of hidden, not intentionally so. You know, there's no Machiavellian, like where you want to hide, you know, the people that have been impacted by COVID-19. But when I say it's hidden data, it's data that has to sort of be fleshed out, right? Like it takes time to actually read an obituary and find an age, and one of the things, again, getting back to data ethics, which, you know, you really don't think about until you start collecting this data, is in some sense I'm assigning a racial category to people that they didn't assign themselves. So right now, in many cases, I'm looking at the phenotypical, the phenotype of people and saying, okay, this person looks Black, but would they have designated themselves as Black? I think in most cases I'm probably fine, but there are certain people, particularly from maybe Hispanic communities or people who are mixed race, right, who may not have assigned themselves the category of Blackness. And in the obituaries, it's not always clear. An obituary doesn't say, you know, Jim Smith, a Black man, right? You know, so I'm, again, coming to this and making some I'm making decisions about who gets this racial category of Blackness and who doesn't get this racial category of Blackness. Do I include someone who may have been from the Dominican Republic and has a phenotype that looks very much as though they have African ancestry, but maybe someone from the Dominican Republic would have seen themselves as a Black American, right? And so these are data ethical questions about who gets included in this data and who doesn't get included in this data. So, and I'm writing about this now.
That's awesome. And I encourage everybody that if this brings up anything for you, this is the cognitive city as a way to have ideas persist. So even if it's just a jumble of thoughts, right? Go ahead and enter in a Spark from here, from anywhere in the city. You can do it from this plus or from the homepage. You can do it from adding a Spark here. So what's coming up? I'm going to admit one. What's coming up for anyone else, given the conversation that we've been having, or from your background, or other conversations that you heard this morning? Welcome, John.
Thank you.
Hopping in and out
between work meetings today.
Not a problem. This is the idea is this could be asynchronous and persisting. So go ahead, Mark. You were going to say something?
The discussion around the emotional affect and science as art seems to revolve around the idea of humanism. And it reminded me of Georgia Lupi, who wrote a book called Dear Data. She really championed this idea of data humanism. Is instead of starting with raw data and spreadsheets and databases and abstracting it away from the human experience, it's really this, how do we weave that into a collective emotional presentation such that we're still connected to the people the data came from, talking about who they are, what their lives are like, and their habits. And I don't really have a point to put on that other than data humanism is something that I consider myself a data humanist, and to fight for the humans that exist in these data sets as people try to pull it away into summary statistics, because there are clever ways to keep the humanity.
I'm under the impression, and I haven't really thought about this a lot, so forgive me if this sounds a little sort of half-formed, but I don't think most data scientists actually, and Mark, I don't think this is what you're saying at all, but it is making me think about the people who work with data in a very sort of strict sort of data scientist way, who wouldn't describe themselves as data humanists, and would even be maybe a little perplexed about why, what it is, what a data humanist is, and why does it matter if you're just trying to develop a sort of statistical picture or, so it's just some data, if you will, to make these decisions. I just don't think it occurs to a lot of people in sort of the data science world, or maybe it does. Maybe increasingly data scientists are understanding the role of humanistic approaches. I know I work in the digital humanities, and so, we're always thinking about that sort of tension between science and the humanities, right? Mostly with humanists feeling as though they're the stepchild that are sort of just tolerated half the time. But Mark, if you will, just say a little bit more about the process of data scientists and why it's important to call out the humanistic, and why that isn't a natural sort of inclination for people who've been sort of formally trained as data scientists.
Yeah, there's sort of the philosophical side and then the logistical side. I think philosophically it can be uncomfortable to be treating people as numbers. And if you're describing disease data or cancer data, being rooted in that can be draining of compassion, just compassion fatigue. But more logistically, if I am trying, or if I am hired by the government to discount the death toll of COVID, I'm trying to figure out a way to dehumanize the data as much as possible. And that feels bad if you are rooted to the humanity of the problem. If you say, oh, it's just 0.1% of, you can string as many statistics together as you like to politicize that sort of message. And I think that is a comfortable feeling for a lot of technical people. They don't like talking, and they like dealing with numbers, and the more numbers and the less people, the better.
Yeah. It's so interesting what you say, because I think there could be arguably another perspective that would say that as a data humanist, that's exactly what you're doing. You're politicizing numbers, right? Like, we need to just look at the numbers. Why are we attaching this sort of humanistic sense to it that actually, again, politicizes it or tries to take it outside of the realm of science? This is science, right? So I think that's not my argument, but I can certainly see how someone who is strictly applying sort of data approaches would say that you're actually politicizing it even more by adding this sort of humanistic part to it.
Yeah. It's almost as if you fight for the data humanist aspect and say it's not 25% of people, that's 1 in every 4. If you're in a family of 4, one of your family is now dead. It's a way of engaging their emotions potentially against their will. Almost.
Yeah. And my response to someone about politicizing data is like, data is always political, right? Like let's get out of this idea that there's anything neutral about data, right? That as soon as you begin collecting data, you are engaged in a political process where you are making decisions for some particular objective. And the sooner you understand that, whether you are trying to hide data or mitigate something, or you're trying to highlight something, be very clear you are engaged in a very political process when you start to work with data.
Yeah. And I think anybody that's worked in data science as a data janitor, cleaning data, has made similar decisions to what you brought up with who qualifies as Black.
Right.
I think as long as you can boil it down to those decisions, and those decisions are ethical,
Yeah.
that's the real goal, I think.
Yeah. Absolutely.
Well, there's been so many conversations about cleaning data, right? And today, right? But that's, you know, and also adding metadata on the data, right? You know, how do you capture the important things? And that's actually really, that's, I don't, you know, I don't clean data myself, but, you know, that's actually some metadata that we should have there. Like, you know, how did you determine who gets included in what? I don't know if that's included when you're cleaning data that way.
Yeah. Or how do you, you know, I have a category of essential workers, right? You know, who defines that? You know, there's a variety of different categories that I've created that actually, and I'm new to data, so don't laugh at me, but I was like, well, I'm going to create the cleanest data set so that no one ever has to clean my data, right? Which is ridiculous, because as I'm creating this data set, it's getting messier and messier. And certainly if I ever pass this data or share this data with people, they are going to have to clean my data. So, you know, even this notion of creating a clean data set is a misnomer in many ways, because there's definitely all sorts of problems with what I've created.
Mm-hmm.
That's a theme with our work as we try to connect different data sets. There's this sort of idea that we can look at existing studies and existing data sets from all over the place, pull them all together, harmonize them, and then draw conclusions from them. And that gives no end of anxiety from the data producers, because they know all of the warts and the various little things that they did wrong. That makes them very uncomfortable for people to say, I'm taking this data as gospel. And they go, no, don't do that.
Yes. Which I don't know, Mark, if you think that inhibits people from sharing their data. I mean, okay, yeah. It's like taking the covers off and exposing all the sort of ugly, right? And there's a certain vulnerability about that.
Yeah, that's one of the things that I'm going off the rails, but this sort of theme of psychological safety, that if I admit that something is wrong with my data, it's not a value judgment on me. It's just me explaining so that people don't misuse it.
Mm-hmm.
So,
and
to Mark's point,
oh, sorry, Austin.
Oh, I was just going to say, to Mark's point, it doesn't necessarily have to be there's something wrong with my data as much as, so here's the heuristic I use to like determine what race someone is. And then as we start to look across sites, that's maybe me collecting the data, and then we try to harmonize that with Mark's. So then he has a different heuristic that he puts in place. And then, you know, there might be a third party that's trying to aggregate our two data sets together, and they might have a completely different heuristic, you know, to Mark's point, kind of beyond my original intention. So yeah, it's a whole nother set of challenges right there.
Yeah.
So I'd like to encourage anyone who hasn't yet contributed to the conversation. What's coming up from you, given your methodologies and the way you look at the conversation that Kim has introduced?
So just to build off of what Austin mentioned and Mark before, but it reminds me of just the idea of what's the purpose of what you're doing, or the stakeholders. And even for software development, Mark, developing components for the data flow program, and why we were building a component a certain way, and then having to connect them together. Same thing with cleaning data, or there was a conversation in the meeting before this about the intent of data visualization and how that kind of completely flipped how you would design the data visualization. And I put that in the Spark I put in. But.
Oh, right on.
And for me, this is a
Sorry.
pretty small thing. But when I was thinking about the opt-out policy, I was thinking it doesn't have to be either or. I know that it's gonna be hard to gather those check marks anyways, but I was thinking we tend to see an anonymous email right there. We have anonymized data in our system too. So I wonder if there's a kind of middle ground where you could just hide names and bios and stuff like that, and still have extra points in the map view.
Yeah.
And let people understand, or it'll help people understand the distribution over the country.
That's great.
And it might also be interesting just to look at where you're getting a lot of opt out kind of responses geographically versus otherwise. There might be some interesting stuff that comes out of that too.
Yeah, no, that's really, really good. And just added to that, when we start crowdsourcing, and hopefully we do get people to respond, also use that as a way to collect data on people, on if there are patterns to who is opting in and what area of the country they might be a part of. Also, I think is really important to which offers another way to collect, information and data.
There might be a good story behind opting out. Yeah, I hadn't even thought of that. Yeah.
Yeah, I hadn't either, but it's a really, really good point.
That could help you with the kind of follow-up outreach program for some area.
Yeah. And then I wonder also too, I think it'd be a really interesting study if you could, if someone is doing data collection or surveying people that are more likely to take the vaccine, and then connecting it with people who've lost loved ones and aggregating those sort of data sets together to see if you're more likely to take the vaccine if you've lost someone in your family, right? I think that would be also another way sort of to work and expand the data and what you can learn from the data. So Josh, thank you. You're making me think about all these other ways to sort of use this data. I've been thinking about it in this very sort of narrow way as a way to recover the lost lives from COVID-19, but I think that the data set potentially can be used in other ways. But then again, what are the ethics behind that? Also, I keep back to that as well.
Yep. I think I cut Kent off. Was Kent on?
Yeah.
Yeah, I was just gonna mention, and sorry I'm coming in late because I had a power outage here, but the talk about data cleaning reminded me of a research assistant position I had in grad school that really emphasized to me the amount of probably unknown power that we give to people doing data cleaning. My job as part of this, as this research assistant, was I was categorizing free text responses from survey data. And about halfway through, I realized just the categories that I chose to group things into could have a huge effect on the outcome of the analysis of the survey. And so I tried to make it as impartially categorized as I could. I was just a grad school student with thousands of survey responses, going through them in R and Excel, trying to kind of pull out themes, but the themes that I extracted could have a very large impact on the results that were kind of gleaned from that survey. So
But Kent, are you saying at the time you didn't have a sense of the power that had actually been sort of bestowed on you through the work?
Yeah, it struck me that just as this grad school student cleaning, categorizing data, I had a huge amount of impact in this menial task that I was doing wasn't really a menial task. It was, very influential on the, possible results that could be gleaned from the data.
So it leads me to ask then, is that something that should be shared with people who are cleaning data about the responsibility or the power that they have?
Yeah, I think it's important for like the researchers to understand like what they're delegating, you know, the amount of responsibility that they're delegating when they, you know, assign these tasks to, you know, an intern or an RA or whoever. I think it's also important for those people doing the task to understand that, you know, they do have this kind of influence over the results and to use that influence responsibly. And I think it makes it kind of like Austin was saying, like, you know, the way in which I, you know, interpreted data, you know, if it differed the way somebody else did, it could lead to very different results from, you know, the same raw data, as it were.
Yeah.
Well, you should definitely, Kent, add that as a spark, because I'm willing to bet that not many people even think about that, right? Just the inherent biases that are automatically going to be there, right? You know, when you come across a word that you don't understand, right? Oftentimes you just discount it as opposed to, you know, especially if you consider it a menial task as opposed to, you know, like this is going to affect what you do with these data is going to affect the funding of, you know, populations across this wide swath of the world, right?
Yeah. Yeah. I mean, it was a medically related survey, and several of the respondents talked about like the use of medical marijuana as, you know, something that they were, you know, interested in. As I was categorizing that, if I chose to, you know, have or not have a category for, you know, interested in medical marijuana, like I could just completely discount those people's, you know, viewpoint in a single kind of fell swoop of like, it's not worth making a category for. So.
And that could very much be determined, like in Seattle, yeah, of course you would, you know, because it's legal here, right? You know, like that's like, but in other parts, you know, in other parts of the world where it's not legal, right? You know, and then you can think about all of that implies, right? Like the parts of the world where homosexuality is illegal, like hiding that data, right? You know, which ensures that we will never know, right? What's actually happening.
Yeah. But then Terry, as you know, say that there, and even this goes with the medical marijuana, I mean, there are security issues around both of those issues, depending on where you are, right? So those are really, really difficult questions and issues to deal with when we're talking about the security of people's lives, right? In some places in the world, to be a homosexual is a, you know, a life or death, you know, situation.
Yeah. Well, it gives a whole new, like when you think about anonymized data, right? You know, you can start to get, you really start to get a sense of what's at stake, right? You know, there's an aspect of like, I don't want, you know, Google to know where I am versus, you know, my life is in danger if I say this out loud.
Absolutely.
Yeah.
One last thing I'd just like to make a note of, I know we're coming to the end of the session, is, you know, and I don't know if anyone has worked with social media data and data mining social media behavior and communication. It's one thing that COVID Black wants to get into because so much of the information that's shared in all communities, but I'm specifically talking about Black communities around COVID-19, has been through social media. And I know people have done a lot of work with Twitter. Facebook's data is a little bit more difficult to get at, but that's certainly another direction that brings up this issue of cleaning data and data ethics in terms of social media data. I would love to know if anyone's worked with social media data.
Anyone here?
Yeah, I've worked with Twitter data quite a bit. Twitter has a very good API, what we use to pull data from. Facebook has shut theirs down a lot after Cambridge Analytica. and they've made everything much, much more difficult to get to.
Yeah.
But
Yeah.
Twitter is easily the first one to go through.
Yeah.
Is
I
Twitter
thought-
dead? So I thought they had tamped down on that a little bit.
Twitter?
Yeah.
Oh, they may have in the last year then. I haven't followed it.
I think their permissions are more stringent about who gets access to Twitter data. From what I understand, I had someone sort of getting data from me for Twitter. Facebook is like impossible to get, which brings up a whole nother, we could spend probably a whole week talking about Facebook and data at this point. But yeah, to your point, I'm not sure, I think that was Josh. I think Twitter data is still much easier than Facebook, but I think it's a little bit more difficult to get at it than it was.
Yeah. Okay, well, this has been an amazing conversation to be a part of, and I appreciate all of your contributions to it. And again, if you'll notice, there's a lot of sparks being added. So in the next session that we're going into, we're actually going to bring together all of this, right? From all 4, 5, 6 different talks that we've had today, we're gonna start to integrate everything that's happened. So there's a at 12:30 CST, and whatever that is in your time zone, you've got a 15-minute break now to take care of yourselves, and I'll see you all back at this link in about 15 minutes.
All right, thank you, everyone. This was a great conversation. I appreciated it.